From headaches to difficulty paying attention, the answer could actually be as simple as a special pair of glasses.
Yes, Dr. Amy Thomas from Arizona Vision Therapy Center is here to introduce us to NeuroOptix. Sounds very intriguing. So let's talk about the science behind these lenses. You're wearing the lenses right now?
I actually am. Yeah, these are my anti-anxiety ones because I get anxious doing stuff like this. Yeah.
But you're so good at it.
Yeah, there you go. Yeah, it's the lenses. It's all the lenses. Okay. All right. So the technology behind these lenses was actually gathered by many, many brilliant minds that had discovered the connection between light and the brain, and how light can actually influence different parts of the brain. So I'm going to come up to this little demonstration thing right here. Okay. So you can see this eyeball right here. These scientists found that pretty much almost every part of the retina is connected to some part of the brain.
Whoa.
So if you activate different parts of the retina, you can actually activate or put to sleep or other parts of the brain. For instance, you have this whole area right here. This is, I call this grand central station of the brain. Okay. Right? This is the one that pretty much tells all the signals where to go. Okay. 80% of them go back to where the 20/20 vision occurs, and that's where everybody thinks of vision, right? But 20% actually go down towards the posture areas. So that you have nice upright posture. Other ones go straight to the emotional centers of the brain, so you can either get really worked up or you can be very calm. Other ones help with sleep cycles, digestion, that type of thing. Quite a bit of them actually go to the motor parts of the brain so that they control how the eyes coordinate with each other. And a lot of times if it's not coordinated between right and left brain, then your eyes jump all over the place and you have problems. So these lenses have the ability to balance it so the eyes can track nice and smoothly and do their stuff.
Right, and it's those eyes not being the partners, and we always talk about this, that causes concentration issues, because if you're not able to look at one particular thing with both eyes, right, that's where the issue comes in. So who benefits from this type of technology?
Well, pretty much anybody could, because this takes that vision up to the next level. But I'm going to give you some examples of people who've actually benefited. This is just from this last month.
Sure.
Okay, so Lionel, he was a struggling reader, and we were able to smooth out his reading so that his vision, so that he could increase his comprehension when he read. Bella had a lot of problems with anxiety because this little area is amygdala right here. Every time she was in a busy environment, anytime there were flickering lights, anything like that, she would become anxious.
Or worked up.
So we were able to get her less anxious with those guys. Ryan, he'd had a head injury in a football accident. He had headaches, and it was worse when he was reading on the computer, especially when he was scrolling down.
Right.
Glasses helped that. Jeffrey had actually been dizzy for about 15 years. He'd had a car accident 15 years ago, and anytime he moved too much, he would get dizzy. So it restricted his lifestyle a lot. Within probably about 3 months, we had him up and running without any dizziness, and the motion sickness went away. Jacob, he'd had problems with attention. He'd actually been through quite a few ADHD medications and nothing seemed to help, and we got him the right pair of lenses and everything.
Wow.
So is this
came together.
One lens fits all, or are these custom made? I mean, not for like if you have astigmatism or anything like that, obviously that's going to be custom fit to the person who has that eye issue. But in terms of these types of glasses, is this a one type glass to fit everybody with anxiety?
No. No. So a lot of times, even with the anxiety, you have different levels. Some people are willing to let you calm them down a little bit, some a lot. So you can't just, like with me, I'm doing the blue. This is the one that really calms people down. Some people don't want to really be calmed down, so you have to go different levels of that. So everything's customized. We do this during the visual skills exam. So we measure there's about 35 different tests that we measure during the visual skills exam to try to figure out what their personality is, what their goals are, what they want to get better, which parts of their brains are being overactive, which ones are underactive, and then we balance that all together in a pair of lenses.
And you brought along a couple different looks because you're wearing some, obviously, but point us, show us the ones you brought.
So a lot of people that come in, they're like, oh God, I'm going to be wearing these goofy looking glasses.
But they're not.
No, these right here, these are called yoked prisms. Okay, so these ones are actually intended to help shift the posture so that you have more of an upright posture and it's easier for you to read smoothly.
Right.
These guys right here, they also have a little bit of a tint in it. This tends to be towards the ADHD kids. What it does is it actually takes away a lot of the stimulation from the periphery so that they have the ability to concentrate on central targets and
not
read
get
a little
distracted.
Yes, very important. Okay.
So they're lenses that fix almost anything, and obviously we've talked about this before too. You go to a regular eye doctor, they don't focus on these types of things,
Nope.
do they? You really need to go to a vision therapist like yourself.
Yep. Yeah. What we do, the big difference between us is when you go to a regular eye exam, they get you in that little 4-opter, and all of your answers come through that little spot in the middle. What we do is we make sure you're in a real life situation. You do eye-hand coordination type things, and you try to figure out how to work with space. And actual tasks that you'd be doing in real life.
So the whole spectrum, so to speak.
Yes,
that's
absolutely.
right. I mean, you were listing off all the examples of how people benefited from vision therapy, the problems they had before. I'm sure people listening are like, yep, that's me.
Oh, yeah.
That's me.
That's
my grandson. That's my child, whoever. I mean, it can apply to anybody.
Yep. And what's really nice about it, it's a pretty quick program.
Yeah.
Usually the lenses I prescribe, they last for about a month, month and a half. And then we switch them out and we go through a progression of lenses. Usually within, it's usually about 6 months and you're done with the program.
Okay.
You go back to your regular lenses or no lenses if you had none.
Very good.
You know, if you've been in about 5 different car accidents, it's going to be longer, but typical
Just
ones are
depends on the
less.
situation. Doctor, as always, great information. Thanks for being here.
Okay. One thing I did want to add though.
Sure.
Okay. All right. Sometimes this works extremely well with people who had really good visual skills before they ended up with the symptoms. So
Right.
car accidents, toxin exposures,
So if you've had
back
something
problems,
happen,
right?
contact
These
Dr.
are
Amy
awesome.
Thomas.
We also provide training for people that needed to learn those skills in the first place.
Okay.
Good. And guys, Arizona Vision Therapy is offering 30% off their visual skills exam. When you mention the Morning Blend, call 520-886-8800 before Valentine's Day to make an appointment to take advantage of that special, or visit azvisiontherapy.com for more information. Dr. Amy Thomas, thank you.